This video is how to take an arbitrary Facebow mounting. This is one part of a series on veneers on maxillary anterior teeth. To watch the other parts of the series, hit the blue link in the description below and subscribe to dentistrymasterclasses.com, and the other videos will be in the video library. You can see we've prepared the 4 maxillary anterior teeth for veneers. Now, something I always do is I sit the patient up, place lip retractors, and take a photograph of the prepared teeth in relation to the eyes, the pupillary line. So you can see this is the pupillary line, a line drawn between the pupils, and that line is also parallel to the floor or the tabletop. I want the technician to see how the prepared teeth, the incisal plane of the prepared teeth, compares to the pupillary line, because the prep model mounted on the articulator should be aligned with the tabletop or the lab bench the same way the patient's prepared teeth are aligned to their pupillary line. So it's very important, in my opinion, that you take a Facebow anytime you're preparing maxillary or mandibular anterior teeth, just so you're aligned correctly, and the technician, when the technician is working with the model on an articulator, it's the same alignment as the prep teeth are to the skull. In other words, if you just prep these teeth and sent the impressions or the model to the technician, he doesn't know if these teeth are slanted this way or this way, if he needs to square them up. So that's what a Facebow does. It aligns the teeth on the stone model on the articulator the same way the prep teeth are aligned in the mouth. All right, so this is a Hanau articulator that I'm using. It's a very simple articulator. I've used these articulators for almost 40 years, and they're just simple. There are other good ones, Danar, but they're more complicated. And I think it's like a rubber dam. A lot of dentists don't use a rubber dam because it's too much trouble. This rubber dam technique I show you takes about 5 seconds. It's easy. It's not perfect, but it's really, really easy, and it's very useful and effective. Same thing with this Facebow and articulator. It's very simple and basic, and it gets the job done, and you'll use it because it's easy and it doesn't take much time. So you heat the pink wax on the bite fork first, and this is an earpiece, Hanau earpiece Facebow from Whip Mix. Whip Mix makes the Hanau articulator. Then once you put the wax on the teeth, you cool it and then put it back to place, and then place the bow on the bite fork, and then this fits in the ears. And then what I'm doing is getting the number on each side. I'm not screwing this in. I'm getting the number on each side of the ear the same, so it's squared to the head. So if this is 5 over here, this ought to be 5 over here. And then once we get those even, I'm holding it like this. Once I get those even, then my assistant tightens this part of the Facebow. See, so this should be the same on this side as it is the other side. This is tightened, and the key with the Facebow, the pink part, the pink wax, isn't parallel to anything. It's just where it is. This part of the Facebow should be parallel with the pupillary line. This part right here. But don't pay any attention to the pink wax part. It just fits the teeth, but this orients the Facebow so that it's parallel to the pupillary line. And then you can see these numbers are the same on this one and this one, but I haven't tightened. I never tighten these. Then we take it off. See, I've never tightened this part. Just only part that's tightened is this. When you get these even in the ears on both sides, be sure you get them squarely in the ears. And before you put them in the ears, even if it's a younger patient, always ask them, do you wear hearing aids or have any ear problems? Because if they're wearing hearing aids, sometimes they're hard to see. You don't want to put those in their ears if they're wearing hearing aids. Then we take this out of the mouth, and then my assistant mounts it on an articulator. Now this part will go up and down, and you can screw this little knob down here in and out and orient this so the pink part, you've got a mounting plate on the top and the bottom, and you want this pink part to approximately split the difference between this mounting part and this mounting plate. And you'd like it ideally to be slanted so that the back part of the pink wax is a little up from the front part. It slants like this, ideally, if that's the way the patient's occlusion is. And then you put these into there's little holes in these plastic things. You put them into these points that stick out of both sides and make these numbers even again. They don't have to be the same numbers that you were set for when you had them in the patient's ears. You just want, if this is a 4 right here, you want that to be a 4 right there. Then put them to place, and then you do screw these in once you get those where you want them. And lift this up, and so this plate should not touch the model. Then you're going to mix some mounting stone and mix it real juicy, real wet. You don't want any body to it because you're going to put the plate on top of it. Just see, that's real wet. You kind of tap it to place so it's not compressed or depressing the bite fork, and then groom that and let it set. Then these are just large paper clips. So she's squirting the super glue on here, the Gorilla Glue in this case, on this the edge of this paper clip, holding it to place, and then squirting that zap it on there that's an accelerator. And then going to put some wet mounting stone on the lower element, push this to place, and then groom it. Let that set up. Do a little more grooming, then you send this part to the laboratory, and your technician can mount the model on this, and this is adaptable to either a hand-out articulator that your technician has or a Danar. So the technician screws this into the mounting plate, then puts the upper model back into the pink wax, mounts it on his articulator, the prep model, and that's how you transfer it to the lab. Very simple. So that's the Dental Minute. These techniques work, and they work every time.